Hello, everyone. Thank you for joining us for yet another session of Facebook Live Chat with an Expert. We will be hosting these sessions every Tuesday for the month of June to discuss some of the concerns caregivers are experiencing during this pandemic. My name is Padma, and I'm a learning specialist with the Alzheimer Society of Calgary. Today, I'm very pleased to have with us Dr. Dallas Seitz, Clinical Associate Professor of Psychiatry with the University of Calgary. Dr. Dallas Seitz is currently an Associate Professor of Psychiatry at University of Calgary since October of last year. Prior to that time, he was an Associate Professor of Psychiatry at Queen's University and the Chair of the Division of Geriatric Psychiatry at Queen's. He was also the President of the Canadian Academy of Geriatric Psychiatry. Dr. Seitz has a clinical interest in dementia, neuropsychiatric symptoms of dementia, and late onset mood disorders. His research interests include knowledge translation in geriatric mental health, evaluation of the safety and efficacy of psychiatric medications for older adults, and health services research related to geriatric mental health conditions. He was very actively involved in policy and advocacy work in Ontario and was a provincial medical lead for capacity planning in Ontario. We are planning to spend about 20 to 30 minutes on the topic of caregiver stress and what caregivers can do to manage their stress at this time. We invite you to ask questions for Dr. Seitz in the comment section of this video, and Dr. Seitz will answer them as we proceed. Considering the very public nature of Facebook platform, we request you to avoid personal questions and to keep your questions in general as possible. I would also like to remind you that this session is not to be considered as a substitute for a medical consult. So first of all, I would like to begin this chat by extending a very warm welcome to Dr. Seitz. So welcome to this chat, Dr. Seitz.
Great, it's my pleasure to be here.
Thank you. I will start with some of the situations that are causing stress to caregivers who are caring for their person with dementia at home. Some stressors caregivers have shared with us are lack of respite care, lack of family respite. That means not having a family member to come and support them as they used to do before, closing of the adult day programs, lack of home care, and care homes not accepting new residents. So I'm very interested in knowing your thoughts. What are your opinion about these stresses, and how can we help caregivers deal with this stress, these kind of stressful situations at this time?
Yeah, so I think, and that's certainly been my experience when I've been talking to patients, as I've been doing, primarily virtual visits with my patients and also with my work in nursing homes. And we know, unfortunately, things like support group programs, in-home respite, day programs, these are really the best supported sort of supports or treatments to help caregivers with stress and distress. So I think it really highlights what an important role these services play for people. So, I think there's probably still some ways to, consider getting ways to sort of connect. And I think one is virtually, some of the things, at least like caregiver support groups and some of your social connections are still available virtually or even by telephone. So I think it's important to continue to try and engage as much as it is. Again, it's not the same as having those in-home respite and support programs, but try to continue to sort of reach out. I would also say, for caregivers, some of the things that I find, can go to the wayside a little bit, even at the best of times, is self-care. So I would really encourage caregivers to make sure that they're not missing appointments with their family doctors, if those are, or their specialists, if those are still available, to make sure that they're still getting medical help and care that they need.
Right.
And then also looking for ways to sort of manage their own stress, because that's something they may have a little bit more control over. So as an example, here in Calgary last week, I attended an online sort of stress and refresh session that was actually put on by the Friends of Fish Creek. So it was a sort of a guided meditation through Zoom, just as an example. And that was for me to join other people in sort of managing my own stress.
Right.
I would say that, for a lot of people too, there may be ways to sort of reduce stress that doesn't rely necessarily on other people. These don't apply to everyone, but for example, even just going for a walk with perhaps the person that you're helping with dementia outside, now that the weather is a little bit more cooperative. Those things have been shown to be, helpful for well-being, both for yourself and the person with dementia. So just kind of looking for opportunities. How do I connect with people? How do I take care of myself? And trying to sort of make the best of a challenging situation, but it does take a little bit of kind of creativity and a bit of problem solving, I think, to kind of learn how do we sort of do the best we can with the resources we do have.
Yeah, very true. I think for the caregivers, they need to kind of dedicate some time for self-care, and that is to be on their calendar. Not just if there is time, I would do that, but deliberately setting apart some time every day for their self-care, for connecting with their family or friends, whoever is in their support network, so that they can at least have a connection with them, even though they are not able to see them, or those people in the support system are not able to come and visit with them. At least having that emotional kind of support and being able to share their concerns with someone would be helpful. Do you think so, Dr. Seitz?
Oh yeah, absolutely. Like I said, that it's really important. I think people have, it's taken a while, but I think people have shifted towards having, Zoom suppers with friends or Zoom connections. And even now as things, again, I'm not completely up to date with the ever-changing sort of policy, but, things have kind of relaxed a little bit in terms of having visits, like particularly outdoors with friends or others. So I think there probably are some opportunities. It can be a challenge to kind of reach out as well, where you don't want to feel like you're being a burden to other people. But I would suggest a lot of us are probably in that situation of kind of feeling lonely and disconnected, and would actually welcome another person reaching out and saying, "Hey, I'd like to connect." So don't be shy about doing that.
Absolutely. Yeah, that's a very wonderful recommendation. Now with, I hear from some of my friends too who are older than me, and what they are trying to do, they are all retired, and they're trying to meet up with their friends in their backyard. And it's almost like, they bring their own food. It's like a potluck where each person brings their own food, their own drinks, whatever they want to drink, their own chair. So they're just spending time together, separated out, physically distancing in the backyard. And that is proving to be wonderful. That's proving to be very helpful for some of my friends. So I think that's something that can be very safely done.
Yeah, and I would say, Calgary is a beautiful city. We have a lot of beautiful nature spots, easily accessible. I think most people in Calgary, again, I know mobility and transportation can be a challenge for some people, but most people are within 5 minutes of a park, in the city.
Yeah.
So I would encourage people to try to set aside some time to get outside when the weather cooperates, and you can connect with people, or even just being outside for 20 minutes, 30 minutes, just sitting outside, can be a inexpensive kind of easy way. Today's a beautiful day,
That's right. Even sitting out
no
on
better
the deck,
time.
right? Even sitting out on your own deck.
Yeah,
and then enjoying the sunshine.
Yeah, it's been shown that's been shown to have, effects on well-being that are, kind of like you might see with some programs like meditation or even the exercise. So it's a
Mhm.
simple thing, but
That's right.
can help you recharge.
Some I've heard from some caregivers that they are a little bit worried about taking their person out to the park or open spaces, because not everyone is wearing a mask, and we can only control our behavior. Right? We cannot expect the others who are using the park also to be mindful of these safety precautions and to be observing them as well. So, what would you say to that, Dr. Seitz?
Yeah, I mean, I would say, in terms of, I think that's that's a valid concern.
Mm-hmm.
The I would say, the risk of contracting coronavirus out in the community is, it's not exceptionally high. We all need to be very careful, but being outdoors in particular seems to be associated with much lower risk than being indoors, where you have recirculated air and things like that. So again, being in a crowd outdoors is going to pose hazards. But provided you've got enough space so that you're able to have your own space, sort of keep the physical distancing even without the masks, I would say it's generally safe if you're not experiencing symptoms yourself. And so I would encourage people to not avoid going outdoors. And I think even very early on in the coronavirus outbreak, our public health officials encouraged people to get outside, but not in a crowded way. And that was before the recommendations with the masks came along as well. And I would say in general, probably the benefits of being outside in terms of your mental and physical health, provided it's not crowded, is probably going to outweigh what would be a very small risk if people aren't wearing masks around you. Of course, wear your own mask. The masks are primarily to keep you from spreading the virus, to protect others. But, it would offer some degree of protection
as well,
from other people as well. Yeah.
Right. Yeah. This is what I've heard. So at least, I'm sure that your answer would now provide some kind of confidence and some kind of relief for caregivers who are doubtful. Is it worth taking the risk? This might encourage them to take the risk and remain safe. And maybe I think it would keep them safer if they try to avoid using the washrooms and things like that. So not stay that long enough.
Yeah, exactly. And so, high touch surfaces outdoors, I think that's probably like where they had all the playgrounds closed for a while, so things like railings and tables, you would probably want to avoid, and of course with the hand hygiene as well, all those sorts of measures. But I would say, I enjoy being outside. I look forward to being outside. I avoid crowded areas, but I certainly don't avoid going outside. For my own health. So
yeah, I know that you like biking is one of your outdoor activities that you enjoy, right?
Yeah, absolutely.
And it's a great, amazing weather to take your bike out and do some biking as well.
Yeah,
even just walking, that'd be great. Okay, so moving on to some of the concerns that caregivers have expressed who have their person with dementia in care homes. Now, they are also experiencing several stresses right from the beginning, but slightly different ones though. So for a long time, they have not been able to visit their loved one in the care home. And this has been very stressful for several caregivers, even though they have been trying to use the technology like the Zoom and the FaceTime and all that. Sometimes the technology is quite difficult for the other person, for the person living with dementia. If they are not familiar with that, they don't see it in the same way as we do. So there is some kind of challenges there as well, because not being familiar with the technology and what they are seeing on the screen, whether it is a real person or not trusting what they are actually seeing. Then also there is another concern about, so maybe we'll talk about this first and move on to couple other concerns. So what would you suggest to caregivers as some strategies that they could use. They could use in this kind of a situation where they are not able to visit their loved one. Are the rules going to be relaxed? In your opinion, what do you feel?
Yeah, so I think, and again, the public health guidance is always the most up to date on this. I think, the guidelines have been relaxed. I believe they're now, permitting homes, provided they have the safeguards in place to allow visits outdoors. With a limited number of visitors, there may even be some in-person visits. It's changing. So again, things are gradually loosening up. I do some work in nursing homes, and I would agree for some people, the Zoom or virtual visits are working really well. They're able to connect. I think for people who have sort of more mild to moderate dementia, the technology is less of a barrier for the person living with dementia. I think the staff in the nursing homes play a key role because it's not obviously just as simple as flipping open a laptop like we might be able to do. You kind of do need someone there to sort of help with the engaging and be the tech support. So, but the homes I've worked with have been, tried to be very accommodating and understanding about this. And I would say we're also seeing, that where we're seeing that people are able to maintain those visits, it's really helping. So I'd really encourage people to try and keep doing that. It is really helping support those people with dementia, and I see and hear all the time about how well the visits are going. If the technology is a barrier, there might be some other things that people can do as well if they haven't done this right, like photo book reminders or memory books, which may be another way to sort of provide connection with family.
Right.
Digital pictures, could be something that could also be sent and shared. Those types of things. So I think, again, this has kind of forced us to be a little bit more creative with it, thinking about those connections. But there's lots of ways to kind of share memories and connections that may not always involve Zoom. I know there's some resources out there. The one that comes to mind is a book called like All About Me. And so these would be these are kind of like life stories. Now, these are often already completed for people with dementia, but again, this can be a way to sort of transfer to the staff who would be working with the individual, what do they like? What do they like to talk about? What are their hobbies? Enjoyable sort of conversation pieces. And so that also gives other people a chance to kind of connect on a personal level and inject some pleasant events into the person's life. So I think there's probably a number of kind of angles we could take to try and facilitate personal connection, even if the Zoom visit or FaceTime doesn't work work as well.
Right, and you touched upon a very very important aspect of connecting. Giving opportunity for the staff in the care homes also to connect with the person. I think that is very, very important in these circumstances, because we have heard from some caregivers that they used to be able to go and give a bath or help the person with dementia in the shower, give them a shave and things like that. And now that they are not able to go, they are hearing from the staff that the person is resisting, their loved one is resisting when these kind of services they are trying to provide, the personal care, the grooming they are trying to provide to the person, they are resisting because they are not used to the staff in the care homes. So this, what you suggested right now, that's a very good idea that families can use and send that information about the person, what they like to talk about, so that caregivers can use that. And it's something they don't have to go and look through records, but something that's very readily available for them when they need to use it. And that might make things easier when they try to do all the personal care tasks right.
And I would say also engaging, making sure you engage the person with dementia, their whole support network. Often, it's a spouse who is
That's right.
living nearby. And
Yeah.
so they're the ones who were doing the bulk of the visiting, but this is
Mhm.
also an opportunity for other family members to get a little bit more engaged if they live away.
Right. Yeah.
So to,
Mhm.
because I think we're seeing more and more visits and access to things like Zoom than we would have ever had in the past had we not been faced with this. So that also gives us some opportunities for children and
Mhm.
friends to
That's right.
connect where they
Yeah.
might not otherwise have been able to.
Yeah. And we have even seen some videos and photos of families visiting the person in the care home outside a window,
Yeah.
celebrating birthday parties and things like that.
Yeah. So
Yeah.
I mean, those are very touching when we've seen those kind of the waves
Yeah.
through the windows, or people celebrating anniversaries and birthdays,
Yeah. Yeah. Yeah.
through
Yeah.
the window. So
Yeah. Yeah.
and I think we'll also see, our nursing homes and families, as things sort of ease up a little bit, we'll see
Mhm.
creative ways to sort of reconnect people,
That's
at
right.
each
That's right.
step of the way. I think people
Yeah.
are very resourceful
Yeah.
in trying to help these situations.
Yeah, absolutely. They're always thinking of new ways and new ideas of still keeping that connection alive with that person. Even driving through in front of the care home, and the person is able to just get out and then stand in the outside the door and watch the motorcade go by, or families motorcade of their family members. So all those are things that are very uplifting for the person with living with dementia, for sure,
Mhm.
right?
Yeah, absolutely. Yeah.
Yeah. So moving on to another concern that was expressed by caregivers, whether person loved one is in a care home, it's that they are worried about the how fast the person's dementia would progress now, because of the absence of stimulating activities. They used to have some socializing opportunities when they go down into the dining room to have meals together, or when they are doing programs or activities together. And that there is no opportunity for that at this time. That is being limited. And the caregivers are getting worried about that. What would be the impact of these kind of cessation of, I'm not getting the word, the cessation of all these stimulating activities, absence of that suddenly with the COVID. How is it going to impact their person? They are worried about that. So
Yeah.
what would you suggest?
Yeah, I think I think in the it's probably related to how long we're in this kind of
Mm,
situation.
that's right. Yeah.
I anticipate, we're seeing, a sort of a gradual resumption back to
Mm,
normal. And,
mhm,
I think it's kind of week to week in terms of, the next stages and steps of things.
right.
But I would anticipate that, a lot of sort of activities or things will gradually kind of get back to normal,
Mm,
or towards normal,
yeah.
over some months, and
Mhm,
probably over a period of time where I wouldn't expect there to be kind of lasting
mhm.
um, um, detriment to people. But of course, this is what I'm hoping for too. But of
Yeah.
course, it's hard to know exactly when that'll happen.
Yeah. Yeah.
I also wonder, over time, as well, it's a hard to say as well, but I
Mhm.
think the nursing homes have, and the supports that are needed for nursing homes have gathered a lot of attention as well.
That's
And so
right. That's right.
one would also hope
Mm,
that, and I think there's been some, some real sympathy from the public and acknowledgement from the government
mhm,
that we probably need increased staffing and supports. And so
mhm.
one would also hope that if this is going to carry on for a
Yeah.
while,
Yeah.
there would also be some extra supports to meet the
Mhm.
social needs of people with
Yeah. Yeah.
dementia in nursing homes. And I can't speak for the government, but I would be surprised, if there wasn't some additional supports provided to help people, now that we're kind of, it looks like through the major crisis,
Mhm.
in terms of the outbreaks, and I'm sure others will occur.
Yeah.
But if we kind of remain in this situation, I really am optimistic that society and our governments will step up and say, well, just like we've got to support small businesses during tough times, and our municipal governments, we've also got to step up and really help this population, which has been disproportionately affected by this. So
yeah, very true, and very well said too. Because if you're familiar with the Dementia Network Calgary, the Alzheimer Society of Calgary, we are the backbone organization supporting the Dementia Network, and they have actually launched an advocacy movement, and they are including rallying the support of caregivers, and they have made some kind of demands on the government to make it possible for family caregivers to relax some of the rules around visitation so that families can visit. Maybe they provide some training for them to how to wear the protective equipment, and even to help out in case of showers and baths and that are required. And the Dementia Network is actually garnering support of caregivers. So if there is any caregiver out there who would like to be part of that movement, and you would like to share your concerns and want to have your voice heard, please take this as an opportunity to note down the Dementia Network Calgary, and Kim at dementianetworkcalgary.com is the email to reach Kim Brundett, who is the person who is the coordinator of the Dementia Network. You can also call us and we can give you some information about how to connect with Dementia Network and how to be a part of this movement that is happening. And just as you said, Dr. Seitz, I think we are going to see some changes happening. I cannot say about how quickly they would happen, but we are also very hopeful that we will see some positive changes happening as we move forward. Yeah. And the other concern that we heard was that many people are worried that because of this long time of absence, when they are not visiting with their person with dementia, they are concerned that what would happen when they ultimately get a chance to visit with the person, to go back and visit with the person. Would their loved one even recognize them? And that is a very sad thing to think about it. If you really are and put yourself in that shoes, I know how hard that thought can be for caregivers. So what would you suggest to caregivers? What are your words of advice for them?
Yeah, well, I mean, it's heartbreaking to think of that. This is such a difficult thing for people to go through at other points with dementia. I would say a couple things. Of course, we know with dementia, long-term memory is preserved, right? So even though the short-term memory may get progressively impaired, those long-term memories, and by and large, we're talking about long-term relationships, with family, those tend to be preserved, quite a long time. So I would say, there's always that risk, but fortunately with dementia, those connections do stay the longest. Also, I would say, often emotional memory. So even if there isn't a sort of clear recognition, there may be an emotional memory, which involves, like a positive response, a smile or a response. That indicates that there's an emotional connection or an emotional memory there as well. And that tends to be preserved quite late in dementia, even like well after, language may be impaired, or where someone, requires a lot of assistance. So for a lot of people, those connections will still be, will still be there. And I think probably most people have been surprised, when something has happened to a person, or they've seen someone that they haven't seen for a long time, and the recognition and the response, and the memories that are associated with someone that maybe has not been present for a long time come back very quickly in very surprising ways. Like she recognized, she hasn't seen Mary in 20 years and she recognized her right away. So
that's right.
So I see that pretty regularly, people being surprised about events and things that people with dementia do remember. And I think that we'll probably also be surprised
Yeah.
with that.
Yeah, as you said, all those long-term memories, they stay for a long time, right? So long-term connections, they would still be there. And even if the person is not able to say verbally, that who is this person, how am I related to this person, but still those emotional connections are very much intact, I believe. And they would still have that softness, whatever soft feelings they had towards that person, it would still be there. So it is just to remain, I think it's very important for caregivers to remain very hopeful and optimistic at this time. Even though these are very challenging times and we have not faced any situation that is even close in similarity to this. This is all unprecedented. But still, I think there is value in remaining hopeful and optimistic, right?
Yeah. Oh, absolutely. Yeah, absolutely. I think we'll all be. I had recently one of my patients in a nursing home who had her first visit with her husband sort of outdoors in quite some time. And this lady does have advanced dementia. And the interaction was, her husband came to visit and the interaction was, where have you been? And people, and she wasn't like upset or angry, but she was just like, where have you been? Like, what's going on? It's been quite a while. And I think everyone was kind of surprised that
Right.
she had a good sense, that the visits had been interrupted and that it had been a while.
Yeah.
How many days or weeks, it'd probably be hard to pin down, but she definitely knew and had that connection and missed it. And it was kind of a cute and touching.
Absolutely. Yeah, I'm sure this will be very reassuring for caregivers, who are having those kind of concerns at this time, that the long time relationships and all those connections and emotions will still be intact. You'll just have to, maybe it takes maybe a smile or some particular characteristic of that person to reignite that connection, right?
Yeah, I think one thing that people have found too, which will relax at some point, is the masks can be difficult. Sometimes that can be both with communication, but also with recognition. And so I think also to take that into consideration for people when you're doing your visits, that we're not going to look normal, right? We're going to be wearing masks and everyone's going to be sort of gowned up in strange clothes. And so that might kind of color some initial visits too. And don't be discouraged about that, because it is, it is obviously, when would you ever visit with your wife or husband with a mask on your face?
That's
right?
That's true. Yeah. And maybe even trying to remembering to speak up so that you are heard, your voice is heard. We suggest to staff in care homes, before they go to enter the person's room and go close to them, to pull down the mask and show who they are from the door. See, this is me. Okay, you're a caregiver. And I have to wear this mask because, there's a bug going around and I don't want to pass that on to you. So that's why I'm wearing this. So at least, pulling it down and revealing who they are. So the person gets to see the real person, their full face as they are, and then moving towards the person. So I think these are little things that we might have to learn, because we have never been used to these kind of situations before, but they are doable and they are simple solutions.
Yeah, absolutely.
Right? Yeah, there's another concern that we have received we have heard from caregivers, and that is especially for people with arthritis and movement, compromised, any mobility disorder, and along with dementia, and they are now wondering whether there's a lack of opportunities for exercise. So there is no formal exercise programs happening in the care homes anymore. And they are worried whether, this kind of lack of mobility, not getting that opportunity to, or not having anyone to take this person out for a walk, whether that could compromise, that could affect their mobility in the long run, whether they would lose their mobility and would have to start using a wheelchair or be bedridden. So there are concerns like that we are hearing as well.
I would say, the nursing homes that I work with most closely, I would actually say, while some of the programs have closed down, I, the patients I've been most directly involved with seem to be getting sort of a similar sort of level of support in even walking around and those sorts of things, not outside, not the group exercise necessarily, but I certainly know that staff are taking people for walks and engaging with them. And and truthfully, I think outside of the group things, if I were to just go through the sort of the records of people, it would be hard to see that their activities and things are changing dramatically at the homes that I've been working at. I think people are still doing everything day to day.
Yeah.
I think where we're seeing the real challenges is all the outside volunteers and families who also do those things, so
right.
So definitely that part has cut back. But I think what the staff within homes are doing, to me, looks like they're really doing a very good job at trying to maintain maintain that as much as they can.
Great. So this can be very reassuring for families, because I think one concern that, one practical difficulty that caregivers are having is not having the opportunity to connect with the staff and the care home and finding out, what is going on. Are you able to take my dad or my mom for a walk? Is that happening at all? Or how is the food? Is she properly eating her food properly? Or what is it like? Is she sitting well? So these kind of very, what you call day-to-day questions pertaining to their daily life, caregivers are not getting an opportunity to talk this out with the staff in care homes. Because as we can understand, there is a shortage of staff at this time, because initially I think staff were allowed to work at multiple sites, but now they are being asked to work at one site. So there is a little bit of a shortage of staff that we are hearing about, and maybe that is the reason why they are not able to spend time with caregivers and talk to them and alleviate their concerns. I guess that's adding another layer of challenge as well.
Yeah, and I think what we appreciate is a lot of those discussions kind of happen. They're multitasking, right? You're in visiting with your loved one, and someone's kind of helping someone beside you with lunch, and you're like, oh, how's my husband or wife been doing with this or with walking? And you're kind of having that conversation while they're doing something else, and so it is a bit of a challenge, because it's that kind of natural connections and observations and back and forth that kind of happen just in little snippets of time, often kind of during visits. For again, the homes I've been working with are still continuing to schedule their care conferences, doing them by telephone. Certainly I've had conversations with caregivers by telephone when there seems to be concerns or questions that have been coming up. So it is a challenge. I would, encourage you to sort of reach out to the nurses or your contact person who might be a social worker. In the homes to even ask, is there sort of a regular time in the week I might be able to call for a bit of a connection and update. And I think most homes are trying to be very, respectful and, about trying to have that communication to continue. But it's not the same as being there, where you get to, the staff, and it's quite easy to strike up a 15, 20-second conversation about a question you might have.
But that's great, because that's, again, it gives the families one more way to connect with the staff. Maybe just have one person, just connect with, as you said, a social worker. Need not be a nurse, maybe a social worker or someone with whom they can have, schedule regular chats on a periodic basis to make sure everything is going well. And I'm very sure that today's conversation has been very reassuring for our caregivers, because Dr. Seitz, you answered all those questions. You gave lots of great ideas, and you were very reassuring. So we are running out of time. So it is time to conclude our chat today. So thank you to all of you for joining us today. I would like to express a sincere, deep gratitude to Dr. Seitz for sharing his precious time and expert knowledge with us. Here is a very big thank you from all of us at the Alzheimer Society. It has been indeed a great pleasure to chat with you today, and I look forward to more opportunities in the coming days. Please join us next Tuesday for a chat with Dr. Alicia Sislak on the topic of repetitive behaviors. The chat again will be during in the afternoon, that is to be accurate, during lunch break from 12 to 12:40, because she's having a clinic in the morning and the whole day, so that's only time available. And today, special thanks to Dr. Seitz, because he's having a clinic day today and he has spared this time to be with us in spite of his very, very busy schedule. So thank you once again. And to all of you who joined us today, please feel free to call us at 403-290-0110 if you would like to speak to a social worker one-on-one, or send us an email at info@alzheimercalgary.ca. I take this opportunity to encourage you to like and share our video and follow the Alzheimer Society of Calgary Facebook page for more videos in the future. Till we meet each other next week, take care. Have a very good afternoon.
Bye.
Thank you.